In this section, we will talk about the abdominal aorta. We'll see all the branches of the abdominal aorta, what are the level for the important arteries coming out of it. And also, guys, we will talk about the arteries which are supplying the gut, the superior mesenteric, inferior mesenteric, and the celiac trunk. So starting with the branches of the abdominal aorta. Well, abdominal aorta, the extension of the abdominal aorta. Now we know that aorta is coming out of the aortic opening of the diaphragm, which was lying at the T12 level. That means the extension, if I talk about for the aorta, for the abdominal aorta, that extension will be from T12 to L4 vertebrae. That is the first thing, extension of the aorta. It is from the lower border of T12 till the lower border of L4, because at the lower border of L4, this aorta will then divide into the terminal branches. Let me just first write down the branches and then we'll show it diagrammatically also. The branches of abdominal aorta, we can divide them in 4 types. Like first of all, we have the branches which are called as ventral branches. So starting with the ventral branches first. The ventral branches are the one which supplies the viscera. So the branches like celiac trunk, superior mesenteric artery, and inferior mesenteric artery. These are the ventral branches of the aorta. They are seen coming from the front of the aorta, so we call them ventral branches of the aorta. Then we have the second type of branches which are called as the lateral branches coming directly from the abdominal aorta. Lateral branches include one of the highest branches, that is inferior phrenic artery. We got this inferior phrenic artery. We got this middle suprarenal artery, upper or superior suprarenal, and then inferior suprarenal. They have a different origin. One come from phrenic, inferior phrenic, and one from the renal itself. So inferior phrenic, middle suprarenal artery, renal artery, and then gonadal artery. These are the lateral branches of the abdominal aorta. You will see them coming out from the lateral side of the aorta. We call them lateral branches of the abdominal aorta. Then third type, we have the dorsal branches of the aorta. The dorsal branches of the aorta includes, we got lumbar arteries. These are paired arteries, usually 4 in number. Fifth can also be there, but that is not coming from the aorta itself. So we have the lumbar arteries and then median sacral artery. Median sacral artery, it's unpaired. Lumbar arteries are paired, so we have 4 pair of lumbar arteries and we have this unpaired median sacral artery. These are the dorsal branches of the aorta. And then finally we have the terminal branches. The terminal branches of the aorta, it divides into what? It divides into the common iliac artery at the lower border of L4 vertebrae. So this is first just about the branches of the aorta, what type of branches we have. We need to discuss these branches in detail. The celiac trunk, superior mesenteric, inferior mesenteric. We got some lateral branches including inferior phrenic artery, middle suprarenal artery, renal artery itself, and the gonadal arteries. They are coming out of the lateral side. Dorsal branches include the lumbar artery, the 4 pairs of lumbar artery, and this unpaired median sacral artery, which you'll see going in front of the sacrum behind the rectum. And then obviously we have this common iliac artery, which is a terminal branch of the abdominal aorta. Well, if I just put it a bit diagrammatically here, because it's always easy to remember when you see the diagram. So guys, let us say if this here is the aorta, let me just draw it thick. This is the aorta here, abdominal aorta. And as we said, this abdominal aorta will divide into common iliac artery, but that will take place at the lower border of L4. And this 4 is important here, because Aorta starts from where? If you talk about thoracic aorta, it was starting from the lower border of T4. Arch of aorta is till the lower border of T4. So from the lower border of T4 till the lower border of L4. That is where the extension of the aorta is. Right now we're just talking about abdominal aorta, but overall aorta start from the lower border of T4 to the lower border of L4. So if I just mark this point here, let's say this corresponds to the lower border of the L4 vertebrae, where the aorta is dividing into this common iliac arteries, the right common iliac and the left common iliac artery, the two terminal branches. As we said, the important branches, we got a celiac trunk. Just below the celiac trunk will be the superior mesenteric artery, and then we have this inferior mesenteric artery. Let me write in short here itself, that is celiac trunk, superior mesenteric, and that is inferior mesenteric artery. The level is also important, guys. If I may write it separately here, the celiac trunk, it is originating at the lower border of T12. As soon as the aorta comes into the abdomen, that gives off the celiac trunk. Superior mesenteric artery, I hope you already remember, in the transpyloric plane, that is a lower border of L1. So it's very close to the celiac trunk only. It is just one segment difference is there. It is a lower border of L1. Whereas the inferior mesenteric artery will be seen originating at the level of body of L3. That originates at the level of the body of L3 vertebrae. So lower border of T12, that is for the celiac trunk. Lower border of L1, that is for the superior mesenteric. And body of L3 vertebrae is the level for the origin of the superior mesenteric artery. The other branches we talked about there, we said we have inferior phrenic artery. Always let's apply the diaphragm, that is called as the inferior phrenic artery. And it's the inferior phrenic artery only which will give off the superior adrenal artery, or you can say superior suprarenal artery. Because then we said we have this middle suprarenal artery is seen just below the level of superior mesenteric artery. Just below the level of superior mesenteric artery, you will see the renal arteries, another lateral branch emerging out, that is the renal arteries. And below the level of the renal artery, just below the level of the renal artery level, we have these gonadal arteries coming out here. The testicular or ovarian artery. So just to remind you, these are the lateral branches: inferior phrenic, middle suprarenal, renal, and gonadal. Then we said we have dorsal branches also. Now what were the dorsal branches? That was the lumbar artery, 4 parallel lumbar artery. Well, lumbar artery originate from their lumbar level, L1, L2, L3, L4. So let me not draw all the lumbar arteries. It will become a bit confusing. Let me just draw the L3, L4. So there is a third and the fourth pair of the lumbar arteries we are looking at. This is the third and fourth lumbar arteries we are looking at. And there were one more artery, if you remember, that was the median sacral artery, guys. This is how the median sacral. Now, I hope this makes sense also why we call it median sacral artery. That is the median sacral artery. Let me just give them a different color. Third and fourth lumbar artery, even first and second as well, which I'm not drawing there. And median sacral artery, these were what branches? These were the dorsal branches of the aorta. So terminal branches is common iliac, ventral branches celiac trunk, superior mesenteric, inferior mesenteric, lateral branches inferior phrenic, middle suprarenal, renal, gonadal, and then we have the dorsal branches that you see in the green highlighted there, the lumbar arteries, paired lumbar arteries, and median sacral artery. We said we may have the fifth lumbar artery also. We have this 4 parallel lumbar artery. The fifth lumbar artery, if present, it will come usually from the median sacral artery itself. Because there is no L5 here. I mean, this is basically it's a continuation of aorta only, this so-called median sacral artery. So if the fourth lumbar artery is coming from the level of L4 only, and aorta is dividing at the L4. So what is below L4? That is median sacral. So median sacral artery, if the question is asked that the fifth paired lumbar artery will come from where? So it is coming from the median sacral artery itself. So guys, this is about the abdominal aorta, the extent of the abdominal aorta and the branches of the abdominal aorta. So from here on, let's talk about the three major arteries, the celiac trunk, superior mesenteric and inferior mesenteric artery. Let's see all their branches, what are the variations you can notice there, and some questions, direct or indirect questions to be asked from that part. So let me start from the celiac trunk first. So starting with the celiac trunk, guys, as we know, celiac trunk is the artery supplying the foregut. From the embryology, I'm very sure that you remember that how much part is the foregut. It is still the major duodenal papilla, that is still the second part of the duodenum, middle of the second part of duodenum. To understand the branches of the celiac trunk, I mean, when you talk about the branches of celiac trunk, the three direct branches of celiac trunk, one is the left gastric artery. We have a left gastric artery. We have this huge splenic artery coming from the celiac trunk, and it also gives off the hepatic artery, or I should say common hepatic artery. So these are the three branches coming from the celiac trunk: left gastric, splenic and common hepatic artery. Let's understand them diagrammatically, that how these arteries are spanning along the lesser curvature of the stomach, where are they going, and that what branches will come out of them. So for that, let me take this stomach here. If this is the lesser curvature of the stomach, and there is a greater curvature with the first part of duodenum as well, let's say we are looking at. Now let me put the celiac trunk here, guys. Let's say this is a celiac trunk, which we know is originating just below the T12. So that is the celiac trunk. Now in the celiac trunk, the one main artery that we just said is a left gastric artery, which you will see running along the lesser curvature of the stomach. And this enters into the lesser omentum. It is running in the attached margin of lesser omentum, which we will discuss in the peritoneum part. And you will see this artery supplying along the lesser curvature of stomach. Not only this will give off the branches to supply the lower end of the esophagus as well. So the artery here is the left gastric artery. Try to label them where I'm doing it so that your diagram is not spoiled. That is left gastric artery. And these are the esophageal branches of the left gastric artery. Let me remind you where we talked about these esophageal branches. We talked about them in the esophageal opening of the diaphragm. Remember, in the esophageal opening of the diaphragm, we have esophagus, we got the right and the left vagus nerve, and we also have these esophageal branches coming from the left gastric artery, which also supplies the lowest part of the esophagus. The second major artery is the splenic artery. Now this tortuous splenic artery, it runs behind the stomach, and once it reaches at the greater curvature of stomach using some ligaments which we'll discuss in the peritoneum, then this will be seen dividing into numerous hilar branches to enter the spleen. So first of all, this artery, as I said, try to label them where I'm doing it. This is the splenic artery. There is a splenic artery, and we need to understand it's the largest branch of the celiac trunk, splenic artery. It's a very tortuous branch because it is running behind the stomach. Stomach will keep on expanding and deflating, so we need the extra length for the artery. So it's quite a tortuous artery. This splenic artery gives off numerous branches to the organs which are running behind the stomach, and that is the pancreas. So it gives off numerous branches to the pancreas. Now I'm just going with a schematic diagram here. So we have numerous branches to the pancreas, out of which three named branches which I need to tell you here. Let me give them number 1, 2 and 3. Well, I gave it number 1. I gave number 1 to the artery that is called as a dorsal pancreatic artery. That is a dorsal pancreatic artery. It is running behind the stomach, that dorsally present, supplying the pancreas. We call it dorsal pancreatic artery. These are the main arteries supplying the body and the tail of the pancreas. That's what the this artery will do. Head of the pancreas will be taken care of by the branches coming from common hepatic as well as superior mesenteric. We'll see that. This is the body and the tail of pancreas, which is taken care of by the splenic artery. So it is giving off this dorsal pancreatic artery. Now, second branch, I just purposefully drew it larger because this is the largest artery supplying the pancreas, called as arteria pancreatica magna. That is arteria pancreatica magna. And third artery, which is supplying the tail of the pancreas, that is called as the arteria chordae pancreatis. Well, you can call it arteria pancreatica chordae also, different name, like some few author call it arteria pancreatica chordae. We call it arteria chordae pancreatis. As the name suggests, chordae, it is the main artery supplying the tail of the pancreas. So these are the, out of numerous branches which are supplying the pancreas, these are not the only one. These are the three major named branches to supply the pancreas: the dorsal pancreatic, arteria pancreatica magna, and arteria chordae pancreatis. These branches supply the pancreas. Once the splenic artery, it comes out at the greater curvature, you can see it is dividing into numerous hilar branches to enter inside the spleen. In the spleen, most of the time, the splenic artery divides outside the hilum only, numerous hilar branches, and those arteries will go inside the hilum of the spleen. In most of the organs, what happens? The artery first goes inside the organ to the hilum and then divides into the branches. But here it divides outside only. But that is not the only thing. The splenic artery also gives off the branch along the greater curvature. Now we have few branches which are going along the greater curvature upward and supplies the fundus of the stomach. Not one, could be numerous branches. And then we have a branch, a major branch running along the greater curvature of stomach in greater omentum. This artery here, guys, this is called as these are the short gastric arteries. These are the short gastric arteries, and please note they supply the fundus of the stomach. They supply this fundus of the stomach. That also was a question asked recently. Fundus of the stomach is supplied by what artery? That is by the short gastric arteries coming from splenic only. And look at this artery which is running along the greater curvature in the greater omentum. Obviously greater omentum will be there. So it is running in the greater omentum. This artery is called as the left gastroepiploic artery. This is called as the left gastroepiploic artery. That is left gastroepiploic artery, which is running along the greater curvature in the greater omentum. It is one of the content of greater omentum. So this is about the splenic artery. Splenic artery obviously supplies the spleen via hilar branches, supplies the posterior surface of the stomach also. It is running behind the stomach, gives off numerous branches to the stomach. It supplies the pancreas by the three major named branches, and then we have short gastric artery for the fundus of stomach, and this gastroepiploic artery is running along the greater curvature. Coming to the third major branch coming from the celiac trunk, and that is a common hepatic artery. Well, that's how they say this is a hepatic artery. Well, there is a hepatic artery which runs along the first part of the duodenum, and then it gives off this hepatic artery proper. So the one way of saying it, that it is actually the hepatic artery only, which goes and then goes into the lesser omentum, which gives off a branch seen running behind the first part of duodenum. And once you see this artery coming out, then the part proximal to it, this is what you call as a common hepatic artery. Write it here only. That is common hepatic artery. This is the common hepatic artery. Common hepatic artery, it gives off these two branches. This branch which is going above in the free margin of lesser omentum, which again we will discuss in the peritoneum, running in the free margin of lesser omentum along with portal vein and the bile duct, that is the hepatic artery proper. That is a hepatic artery proper. And the one that you see running behind the first part of duodenum, well, it has to run behind only. First part of duodenum is peritoneal. Second, third, and fourth part are retroperitoneal. And that's why if any blood vessel, any portal vein, bile duct, anything has to run in relation to the first part of duodenum, it will be behind. It's a simple rule. I mean, that's a very common sense here. In the abdomen, if the organ is peritoneal, like transverse colon is peritoneal, so obviously we'll see superior mesenteric artery and all going behind it because it's peritoneal, it's in front. If anything is retroperitoneal, the blood vessel will be seen running in front of it. Like the same superior mesenteric artery, which will be behind transverse colon, but it will be in front of third part of duodenum. Because third part of duodenum is what? It's retroperitoneal. So this rule will, like splenic artery, guys. Splenic artery, why the splenic artery is not going in front of the stomach? Because stomach is peritoneal. So the splenic artery, it runs in behind the lesser sac because stomach is already there in the front. It cannot go in front of the stomach. So I would say in abdomen, when it comes to these blood vessels, there is no point in mugging up all these relations. It's easy and sensible to remember. If a structure is peritoneal, artery will be behind it. If it is retroperitoneal, the artery or whatever, the duct, everything, you'll see it in front of it. So following the same principle, this artery is running behind the first part of duodenum, and that is the gastroduodenal artery. This artery is called as gastroduodenal artery. Let's take them one by one first. Now, as we said, hepatic artery proper. First of all, hepatic artery proper, it runs in the free margin of lesser omentum and it divides into the right and the left branch. Let's say this is the right branch of hepatic artery and there is a left branch of hepatic artery, once again before entering the liver only. And usually, not always, usually the right branch of hepatic artery is the one which supplies the gall bladder. So cystic artery is most commonly the right branch of hepatic artery proper. That is a cystic artery, which I said usually it comes from the right branch of hepatic artery proper. Coming below to the gastroduodenal artery. Now gastroduodenal artery is running behind the first part of duodenum. So first of all, there is an important clinical anatomy you should remember here. Because the first part of duodenum is prone to ulceration, and if there is a perforation of the posterior wall of the first part of the duodenum, the blood vessel which will be involved in that will be the gastroduodenal artery. So you can note that the gastroduodenal artery, it can be involved in the perforating ulcer of the first part of the duodenum. The perforating ulcer of the first part of the duodenum, the artery involved will be the gastroduodenal artery because it is present behind the first part. Once this gastroduodenal artery, it comes down here below the first part of the duodenum, it divides into two branches, one which goes here, that is the right gastroepiploic artery, which is running in the greater omentum and anastomosing with that. And then it gives off the superior pancreaticoduodenal artery, which usually divides into one anterior branch and one posterior branch. So this is the right gastroepiploic artery, and here we have the terminal branch or the last branch of the celiac trunk, that is called as a superior pancreaticoduodenal artery. Well, as I said, superior pancreaticoduodenal artery, it usually divides into anterior and posterior. It is running in the groove between the duodenum and the head of the pancreas. In the duodeno-pancreatic groove, it is running in there. So obviously, as the name suggests, it supplies mainly the second part of duodenum, and it also supplies the head of the pancreas as well. The name says pancreaticoduodenal. Head of the pancreas will be somewhere here in this, isn't it? So it is running in that pancreaticoduodenal groove and supplying the head of the pancreas as well as the second part of duodenum. Now, there are a few more questions to be answered here. And one more artery which I need to put. Apart from these branches, guys, we said left gastric artery is running along the lesser curvature of stomach. Now there has to be a right gastric artery also, because the lesser curvature of stomach is also supplied by right gastric artery. The question here is, right gastric artery is a branch of. If you see most of the basic textbook of anatomy, they say that right gastric artery is coming from common hepatic. That is correct, not wrong. But as per Gray's, the right gastric artery most commonly is a branch of hepatic artery proper. Look at this. It's the hepatic artery proper which in most of the cases gives off this right gastric artery. So I recommend you to please write it down separately also, that if the question is asked on the right gastric artery, better answer than common hepatic will be the hepatic artery proper. It's a hepatic artery proper which usually gives off the right gastric artery. That means after the gastroduodenal artery is given off. Another important point I want you to please note it down. If the question was asked that what is the largest artery of the stomach, largest artery of the stomach, don't go for the length. Splenic artery is the longest branch or the largest branch of celiac trunk. The question was what is the largest artery of the stomach, and please note that is the left gastric artery. Well, that's the only gastric artery coming directly from the celiac trunk. So don't go on to the shape that it is just supplying along the lesser curvature. It is the largest. The lumen, when you look at the lumen, you will realize it is the largest artery of the stomach. It's the same difference that we in the cranial nerve when we said largest and longest. Largest nerve is trigeminal, longest is vagus. So they're not asking you longest, they're asking the largest artery of the stomach, and that is left gastric artery. And there's one more question which I want to discuss with you. It was the question asked in the AIMS exam, in which the question was about the blood supply to the first 2 centimeter of the duodenum. The first 2 centimeter of the duodenum. And what I've seen that the answer to this question is given just based on the references of Gray's Anatomy or something, in which the first 2 centimeter of duodenum is not explained separately. In Last's Anatomy, that was the only book in which this is clearly mentioned, that the first 2 centimeter of the duodenum, and not the first part, guys. First part of duodenum is 5 centimeter. We're just talking about the first 2 centimeter of duodenum, which is forming the duodenal cap. Radiologically, it's important, the duodenal cap. So that duodenal cap region, or the first 2 centimeter of duodenum, you'll be surprised to know it is supplied by almost every single artery present in the vicinity here. It is supplied by gastroduodenal, it is supplied by right gastroepiploic, it is supplied by right gastric artery, it is also supplied by the hepatic artery. So let me write that for you. The first, or you can say the proximal 2 centimeter of duodenum, or so-called duodenal cap, first 2 centimeter of duodenum or duodenal cap, it is supplied by what artery? It is supplied by the hepatic artery. It is supplied by the right gastric artery. It is supplied by the gastroduodenal artery, branches from the gastroduodenal artery, and it is also supplied by the right gastroepiploic artery. Also supplied by the gastroepiploic artery. That is the blood supply for the first 2 centimeter of the duodenum, or you can say the duodenal cap blood supply. Hepatic artery, right gastric, gastroduodenal, and the right gastroepiploic artery. This, as I said, the reference, I took it from the Last's Anatomy. It's not mentioned in the Grays. They have talked about the blood supply to the first part of the duodenum, but not the first 2 centimeter. This is very precisely mentioned in the first 2 centimeter of duodenum is supplied by what artery. Last Anatomy is one of the very favorite book for for our even our senior faculties, and I've seen that it is one of the very a book which is favored by the senior lecturers and professors, and I believe that it's an old question of AIMS, so probably they took the question directly from the Last Anatomy itself, asking about the first 2 centimeter. So guys, this is about the branches of the celiac trunk, right? This is about the celiac trunk. Some direct question about the branches, where they're coming from. Some indirect questions, which is about what is the main artery for the fundus of stomach. Then we have what is the largest artery of the pancreas, where the right gastric artery is originating from. Cystic artery will come from where, and the first 2 centimeter of duodenum branches. So just be careful about what kind of question is asked. Now, moving on from the celiac trunk, let's now move on to the superior mesenteric artery and the inferior mesenteric artery. So let's do one thing. Let's have a comparative, the column for the superior and the inferior mesenteric, and then again we'll see it diagrammatically. So guys, superior mesenteric artery, if I may write, superior mesenteric artery branches on one side and inferior mesenteric artery on the other. We know that superior mesenteric artery is the artery for the midgut and inferior mesenteric artery is for the hindgut. So the branches of superior mesenteric artery will be supplying from the major duodenal papilla till the right 2/3 of transverse colon. Superior mesenteric artery. If you look at the branches of the superior mesenteric artery, first of all, superior mesenteric artery, if you look at the concavity of the superior mesenteric artery, the artery is arching toward the right side, which makes sense because superior mesenteric artery is supplying the small intestine, it supplies ascending colon, and the right 2/3 of the transverse colon, cecum, appendix, the structures which are more toward the lateral side. Whereas the inferior mesenteric artery is the one which need to supply the descending colon, sigmoid colon, and rectum, which is obviously toward the left side. So as a general orientation, the superior mesenteric artery branches will be seen going toward the right side, inferior mesenteric artery branches toward the left side. Superior mesenteric artery gives off numerous jejunal and ileal branches. These are the branches which are, if this is my superior mesenteric artery, you will see these branches are going toward the what side? Toward the left side, because they have to supply the jejunum and ileum. Artery itself is going toward the right side, but these jejunal ileal branches are more of a left branches. They supply jejunum and ileum. Superior mesenteric artery. Now, what was the last branch of the celiac trunk? That was the superior pancreaticoduodenal. So this will give off what? Inferior pancreaticoduodenal, which will also reach till the major duodenal papilla and anastomose with them. That is inferior pancreaticoduodenal. That is inferior pancreaticoduodenal artery. This will also divide usually into two branches and will anastomose with the branches coming from the superior pancreaticoduodenal. Then it gives off the artery called as the ileocolic artery. The ileocolic artery will have one ascending branch and one descending branch. We will see that. Ileocolic artery. It will also give off these branches which is called as the right colic artery supplying the ascending colon. This is called as a right colic artery. And the main artery supplying the transverse colon, mainly the right 2/3 of transverse colon, and we call it what? Middle colic artery. That is a middle colic artery will also be seen here. So these are the branches which are coming from the superior mesenteric, jejunal and ileal branches, inferior pancreaticoduodenal, ileocolic, right colic, and middle colic artery. We'll see most of the major branches separately. The inferior mesenteric artery, on the other hand, which we know is coming from the level of the L3 vertebrae, this inferior mesenteric artery will give off the branches. And these branches, the one will be the left colic artery, the main artery for the descending colon, that is left colic artery. It gives off numerous sigmoidal arteries, and it will also give off the superior rectal artery. In fact, superior rectal artery is the continuation of the inferior mesenteric. We got right colic, we got superior sigmoidal artery, and then we have superior rectal arteries. As I said, superior rectal artery is the continuation. When I'll show you in the picture also, you will see that inferior mesenteric artery will be seen continuing as the artery which is called as superior rectal. Rectum is supplied by superior rectal, inferior rectal, middle rectal, and all the three rectal arteries are coming from different sources. This is one you're looking at right now, that is superior rectal artery. Now let's try to put all the major branches in the concavity of the large intestine and see how these arteries will behave there. So we have the ileocolic, right colic, middle colic, and let's take three branches from here: the left colic, sigmoidal, and the superior rectal. And the picture that we will be looking at, guys, I mean the diagram that we'll draw here, this is the diagram in which the transverse colon is lifted like this. Please understand this. Transverse colon is connected by the transverse mesocolon, which again we'll discuss in the peritoneum. This transverse colon, if I reflect it above like this, so that I can clearly see the ascending colon, then I can see the transverse colon, and then I see descending colon. So when you're looking at the diagram that we're drawing, in which the transverse colon is lifted above, so that the middle colic artery can also be appreciated. So let me just keep it simple here. If this is the cecum and appendix, here is the ascending colon. That is a transverse colon that is lifted up. That is descending colon, sigmoid colon, and rectum. We don't have to see the entire artery in here. We already know some branches which are jejunal branches and superior pancreatic and duodenal, just barring those arteries. Guys, look at superior mesenteric artery. We said if this is a superior mesenteric artery, it will give off the ileocolic artery. It will give off the right colic artery, and it will also give off this middle colic artery. As I said, I'm just looking at the major branches here. Ileocolic artery. I'm just writing IC. Ileocolic artery. Now, when you see the ileocolic artery, I said it gives off an ascending branch and descending branch. Now, to understand the ascending and descending branch, first look at this right colic artery. Sorry, right colic artery also gives off an ascending branch and the descending branch. So the ascending branch of the ileocolic artery will anastomose with the descending branch of the right colic. That is the right colic artery here. And you can see one descending branch of the right colic artery is anastomosing with the ascending branch of the ileocolic. I'm writing IC, that is ileocolic artery. Whereas this descending branch of ileocolic artery, that is the one which is the main artery supplying the terminal ileum, that also supplies the cecum, that also supplies the appendix. So it gives off the cecal branches. We have anterior and posterior cecal branches. I'm not drawing both. Let's say this is cecal branches supplying cecum from both the side. And it also gives off the appendicular artery, which is running in the free border of mesoappendix. These are the cecal branches. We have anterior and posterior cecal branches, although, and this is the appendicular artery. This is the appendicular artery which is running in the free border of that peritoneum which I've highlighted there. That is mesoappendix. It is running in the free border of mesoappendix. That's why we can ligate it also easily. Okay, so that was about the ileocolic. Right colic artery you can see is having an ascending and descending branch. Similarly, we have this middle colic artery which is also giving off the transverse branches. We have a right and the left branches here. That right branch will anastomose with the right colic, and we have a left branch also which goes till the junction of the midgut and hindgut. Let me put this line here which is corresponding to the junction of the midgut and the hindgut. This is the hindgut part. Let me just highlight the hindgut part so that it will be easy for us to trace the branches separately. Okay. This artery here is the middle colic artery, if I may label. This is a middle colic artery. Well, that's the contribution coming from where? From the superior mesenteric artery, if I may. Right here, this is the superior mesenteric artery. On the other hand, inferior mesenteric artery, if I put that, inferior mesenteric artery, first of all, we said it will continue down as a superior rectal artery. It will give off the left colic artery, which also have these ascending and the descending branches. It also gives off the sigmoidal arteries, all the numerous sigmoidal arteries, which are again having the ascending and descending branches. That is sigmoidal arteries. Could be numerous. Let me write that. This is the left colic artery. That is left colic artery. Sigmoidal arteries. And that's the continuation of the inferior mesenteric, that is superior rectal artery. You will see superior rectal artery going till the S3 level, and then it actually enters into the rectum. It goes to the level of S3, and then it divides on both the side, and then it actually goes to the muscular wall of the rectum and supplies it. This is inferior mesenteric artery. That is inferior mesenteric artery. Well, the important thing to understand here that all these arteries running in the concavity of the large intestine, and these arteries are having these ascending branch, descending branch, and these right and left branches which are anastomosing with each other, which is an advantage. These ascending, descending branches, they are the one which gives off the recta branches or the vasa recta branches or the straight arteries which is supplying the ascending colon, descending colon, transverse colon. That is all because of the branches coming from these ascending and descending branches. So this artery here, this artery which is formed inside the margin, this is called as a marginal artery of Drummond. This arterial arcade, this circle which is formed inside, is called as the marginal artery of Drummond. This is called as marginal artery of Drummond. And this marginal artery of Drummond is why this is of immense importance, because imagine if even any major artery out of this is not present, still this marginal artery of Drummond can take the blood supply from the other part and supply that region. Like one question here, and I wanted to please note it down also. Right colic artery, that is the name's question only. Right colic artery is the most commonly absent artery of the gut. Please note that. Right colic artery is the most commonly absent artery of the gut. It's the most commonly absent artery of the gut. When middle colic artery can be absent as well, but the most commonly absent artery of the gut is the right colic artery. And imagine even if the right colic artery is absent, still the ascending colon is supplied. Why? Because of all these marginal arteries. We have a longer marginal artery. This iliocolic artery will give off the marginal artery running till here, and middle colic artery, marginal artery will come down till there, and that will supply the transverse colon. And that's the advantage of having this marginal artery of Drummond. Now, even though we have the marginal artery of Drummond, still you can see the junction of this, the branches of the marginal artery at the junction of the middle, midgut and the hindgut. Now, you may have insufficient anastomosis at that region. You may have an incomplete anastomosis at that region. You may have an absent anastomosis at that level also. Anything is possible there. And this point here is called as a Griffith's point. That is called as a Griffith's point. And this Griffith's point is the one which is a watershed area. This is a watershed area. If the marginal arteries are coming till there, let's say not supplying this region here, so that is a Griffith's point. And watershed area, this is called as a watershed area, guys. You will see the blood supply is separate from here. You will see the lymphatic drainage in the opposite direction. You will see the venous drainage also in the opposite direction here. So we call it the watershed area. The splenic flexure of colon is the watershed area. That is a watershed zone. That is a watershed zone. So what you see, if let us say there is insufficient anastomosis between the marginal artery at the level of Griffith's point, now in some people they are gifted with an additional anastomosis, additional artery which is there. Let me use a different color to show that artery so that there is no confusion when you revise your notes. I'm just using a blue color here, although it's an artery only, which is connecting the middle colic artery to the left colic artery. Look at this. This arc here, guys, this arc is called as the arc of Riolan. That is called as the arc of Riolan. It is connecting the middle colic artery to the left colic artery. We call it arc of Riolan. And that's an advantage. I mean, arc of Riolan, it's a anastomosis between the branch that is coming from the superior mesenteric and to the branch of the inferior mesenteric. So do remember, it is connecting what? It is connecting the middle colic artery to the left colic artery. They even ask this question in this way once, that it's a connection between what? I mean, it's a connection between the proximal part of superior mesenteric to the proximal part of inferior mesenteric. Make sure to write it also, that arc of Riolan is a connection between the proximal part of superior mesenteric artery to the proximal part of the inferior mesenteric artery. The options were arranged in such a way: proximal part of superior mesenteric to the proximal part of inferior mesenteric artery. So that is about the arteries of the gut. So we saw the branches of the aorta, we saw the celiac trunk, superior mesenteric and inferior mesenteric artery, how they are branching, and what possible questions which can be asked or were asked in the previous year examinations. Let us look at this one comparative picture also here to see what arteries we just discussed. So you can see here that is a superior mesenteric artery. Now, and you can see the superior mesenteric artery here, it is passing in front of the third part of duodenum. I told you, third part of duodenum is what? It's retroperitoneal. So artery will be seen running in front of it. and it is behind the transverse colon. This is the transverse colon which is reflected. If I leave this transverse colon below, it obviously will be present in front of the superior mesenteric artery. So this is superior mesenteric artery. You can see that's a main superior mesenteric artery. All these cut branches, look at this, all these section branches here are the jejunal and the ileal branches, which I told you that they will be seen toward the convexity. This is seen toward the left side. This is the jejunal and ileal branches. And look at these three major branches. That is the ileocolic artery. That is a descending branch here, and that is an ascending branch. And if you look carefully first, the descending branch, ileocolic artery descending branch, it will give the branches to cecum. I hope you can notice that. Can you see the branches going to the cecum from here? And please look at this artery which goes behind the terminal ileum and supplying the appendix, running in the free border of the mesoappendix there. That is appendicular artery coming all the way from the ileocolic, descending branch of ileocolic artery. If I go slightly higher here, this is the right colic artery. Again, you can see the descending, ascending and the descending branches. And we have this middle colic artery also having these right and the left branches. And you can see all these are anastomosing with each other, giving off these, the vasa recta, the straight branches which are supplying the ascending colon and the transverse colon. The marginal artery of the Drummond is being formed. On the other hand, if you look at inferior mesenteric artery here, the inferior mesenteric artery, guys, let me go with the continuation first. Inferior mesenteric artery, look at this artery continuing down here. This is the superior rectal artery, that's a continuation. Look at all these direct branches coming here, and these are called as sigmoidal artery. They will supply the sigmoid colon and the lower part of the rectum. So we call them sigmoidal arteries. And this is the left colic artery. And you can see the left colic artery is also having these ascending branches and the descending branches. Look at all these. This is also branch of the left colic. This is also branch of left colic. And they further divide into ascending and descending branches, supplying the left to 1/3 of the transverse colon and then the descending colon. So this is about the branches of the superior mesenteric and the inferior mesenteric artery.